According to data from World Health Organization, the number of new cancer cases globally will reach 35 million by 2050, which is 77% higher than the figure in 2022, noting that there is an estimated 20 million new cancer cases and 9.7 million deaths in 2022. President, Defense Police Officers' Wives Association says the event is aimed to advocate for improved access to healthcare services for cancer patients. She says it is a routinization of cervical and breast cancer screening, a substantial step towards early detection, timely intervention, and ultimately saving lives.
Mark this day, we must acknowledge the reality that cancer knows no boundaries. It affects individuals and communities worldwide, regardless of age, gender, socioeconomic status. Making this screening a frequent part of healthcare service will empower individuals to take charge of their health, detect cancer at its earliest stage, and assess the care and support they need. But our efforts must continue. Closing the care gap requires a collective commitment to raising awareness.
In his remark, the Commander Defense Headquarters Medical Center, Surgeon Captain Victor Igboezu says, cancer remains a global threat due to access to diagnosis and treatment, adding that early detection and prompt intervention will save lives.
So what we are doing today, what Depowa and their partners are doing today is the right thing. They've lent their voice, they've lent their hands with the global voice that's aimed at closing the gap, reducing the inequality in terms of healthcare, reducing that gap in terms of healthcare in management of cancer. Because it's believed that when this gap is closed, the access to early screening, detection, and treatment will eventually save the lives of the greater parts of Africa and generally.
Some of the patients at the event call on the federal government to subsidize the cost of medical so as to allow the vulnerables to have access to drugs.
And then for the government, let them make our drugs cheaper. I know that a lot of things has been happening. They've been doing, like there's a cancer health fund, but the problem with the fund is that most of the drugs that the fund covers are not available. So cancer patients still have to go out, source for money to buy these drugs. So my own advice and plea to the government is that they should get these pharmaceutical companies, make them bring in through them on subsidized rate to remove the middleman that makes it to be too expensive, so that our cancer patients, even if you're not treating freely, but let the drugs be affordable.
Ignorance is not an excuse when it comes to cancer treatment, and timing is very key, because the more you delay without doing anything, the more it spreads. So the best thing is get to the hospital and be praying, because when you pray, obviously the drugs will work, because most people will take drugs that will not work. So get to the hospital, get yourself checked, start treatment, just follow the doctor's instruction as you are praying.
However, over 200 women across all services are built to benefit from the program as Depowa launches the routinization of cervical and breast cancer screening, a substantial step towards early detection, timely intervention, and ultimately saving lives. Kikelomo Okeri, Global Television News.